All right, good afternoon, everyone. Thanks for joining us for the Meet Our Scholars webinar. Today we're meeting our Behavioral Health Scholar and our Physical Rehabilitation Scholar and their supervisors. So I'm going to invite them to introduce themselves in just a minute. My name is Alan Lebo, and I manage the Scholars Program here at Church Health. It is a one-year gap year program for students who are interested in learning more about faith and health and just exploring healthcare careers. And so we hope you learn a little bit about the scholar experience and the program and what you could experience here at Church Health through this webinar. So with that, I'm going to go ahead and invite our scholars to introduce themselves. Avani, do you want to go ahead and go first?
Yeah. My name is Avani Alapati. I am the Behavioral Health Scholar. I'm from Baton Rouge, Louisiana, but I went to Rhodes College and graduated in 2019. I came to Church Health because I really liked the holistic way that they looked at healthcare, or that we look at healthcare. And I've always been interested in working with the underserved population, and I get all of that out of working here at Church Health.
Great, thank you. Etta, do you mind introducing yourself?
Yeah, of course. Hi, I'm Etta. I graduated from Rhodes College in May 2020, so just a few months ago, and I'm the Physical Rehabilitation Scholar at Church Health. And I'm from Dallas, and I want to study physical therapy. Hopefully next year. I applied to a few schools, so we'll see. And I came to Church Health because I took this class at Rhodes my junior year that talked about like the intersection between faith and health outcomes, and like how belonging to a religious community like alters your health outcomes and in a positive way. And as someone who like had never really had a really profound relationship with faith, I found that really interesting. And like, so that was really interesting to me. And also kind of what Avani was saying, just like being in a clinic that has so many different departments in one building is really cool, because you get to serve someone holistically in so many different areas of their healthcare. So yeah, it just seemed like a great opportunity to learn more and yeah, dive in.
Awesome. Well, thank you. We're definitely glad you're here at Church Health. At this point, supervisors, I'm going to invite you guys to go ahead and introduce yourselves as well. I'll let you guys just go ahead and jump on in.
Okay, well, I'll start, I guess. My name is Butch Odom. I'm the director of behavioral health, and so Avani is a scholar working in my area. And on March 1st of next year, I will have been here 30 years.
My name's Kevin Gibson. I'm a physical therapist, and I'm the manager of our physical rehabilitation department. Really happy to be able to work with Etta. I'm from Richmond, Virginia. Moved here with my family about 10 years ago. Heard about this place called Church Health, and from my experience working in the hospital and seeing how little access, how many challenges, how many barriers there were to people getting access to good physical therapy, it was really important to me. So I started volunteering here, and now I work here. So love being here.
Nice. Well, thank you all for sharing. So with that, Etta obviously works with Kevin in physical rehabilitation and Avani with Butch in behavioral health. And so the scholars, especially this webinar, kind of helps highlight the versatility of the roles and kind of what they do in different departments. Could you, and starting with the scholars, kind of describe what you do at Church Health? What is your role, Avani and Etta?
Every day, like what a regular day looks like for me is I come in, I manage the counseling and the volunteer schedules. I scribe for psychiatrists. I do a lot of administrative work as well, along with the nurse here, Rose. So yeah, it's a lot of different things that come from all parts of behavioral health. But that way, it's good because that way I get to like put my foot in a lot of different areas here. So.
Good. It kind of sounds like you get that all around experience. So not just kind of one small area of the field, but a kind of a breadth of it. Okay, cool. And Etta, how about you?
Yeah, so I act as like support staff for a lot of the physical therapists in the clinic. So that means I like prep a lot of patient paperwork, like do scoring. I take patient vital signs and like put that into our like health records on our computer. I help translate for a lot of patients. And then if a therapist needs help with like preparing a certain modality, like a heating pad or an ice pad, I like prepare that and bring it to them, and just like prepare treatment rooms and things like that. But more than that, I get to interact with a lot of patients. Right now, we only have one entrance into Church Health. So in PT, we're like all the way on the side of the building. And so I am one of the staff that like walks to and fro, like bringing people back and forth. So just like talking to them about like how they're doing and how their treatment is going, and like just daily life stuff. So it's really cool to connect with patients in that way and just like, I don't know, like build that professional relationship with them has been really cool. And also just like observing a lot of their treatment. They're out in a gym space. So I'm also out there and can like observe and listen. And it's been just a really great learning opportunity for me.
Okay, and so with that, it sounds like you get a similar experience in terms of kind of getting a breadth of experience, but a little bit more focused and kind of in the physical rehabilitation and physical therapy world. So with what you both kind of said, what would you say is a scholar at Church Health? How would you describe a scholar to somebody else?
I mean, a scholar essentially is, somebody who is interested in the department that they are a scholar for. I mean, personally, I'm really interested in mental health and psychology. So I think being a scholar is getting experience. Like what you do as a scholar is you get experience and you get to like kind of almost be like a fly on the wall in like a real life situation where I get to talk to counselors every day about what they do. I get to sit through psychiatry appointments, which I think can be really interesting. I get to go down to the clinic and see people, and I get to hang out with other scholars like Etta. And I mean, it's just like a good program where you can just get a little bit of experience before you really go to school or become whatever professional that you want to be.
Yeah, I would totally agree with everything Avani just said. I would just maybe add like you really take on like a sort of like a student role. So a lot of people are like pouring into you about like what their profession is like and like some of the challenges they have and some of like the successes they have, things that they think are important in their work and like, like areas that still need growth and stuff. So you just get like a really cool view into your profession of interest. Yeah. And I think transitioning out of college, for me, the scholars program has been like a really educational and like like maybe comforting or like safe space to be after graduation, because I knew that I wanted to take a gap year. But like if I hadn't been in a program like this that I knew was going to like launch me in the direction that I wanted to be, I think it would have been a lot harder. Not that it can't be done, but for me, it was just really, it's been really helpful. So.
Jump in on this and just say, I think it's important to remember that the scholars are future clinicians, right? We're trying to give them an experience that hopefully helps to prepare them to take that next step, right? So a scholar really is, yes, they're doing some really mundane things sometimes, right? There's just work that has to be done, but that's sort of the nature of all of our lives. And I mean, there are things that just need to be done. But in that, you learn not only, certain skills along the way, you observe a lot and you experience. I've really enjoyed being able to see Etta sort of grow into, growing in confidence and talking with patients and being able to deal with difficult situations and things that will directly apply to like her career as a physical therapist at some point, right? Anyway, so a scholar really is a learner, though there is work. It's hard work, so.
Right. I think you, and so, I'm glad you jumped in, Kevin and Butch. If you have anything to share, please jump in as well. But I like how you both all kind of, Etta and Avani, you both frame that as very much the scholar is a learner, and it seems that the staff around you and the people around you seem to understand that and kind of cater to that. And then Kevin, I think you bring up another side of it is with that, there is a level of hard work and sometimes, like you said, tedious work that might need to happen. But like you also said, that is part of everybody's job every day. And so I think it goes also back to the point that you said, Etta, with, this really is kind of help with prepping after kind of college life and getting into more of this professional career and this professional mode. And so sometimes what we get from a lot of scholars is that help them prep for going back to school and understanding what this professional experience would be like and how it would be different from what they kind of perceived it as when they were in college. So.
Well, I would also say that, we really need the scholars. They're real jobs that have real job descriptions attached to them that in the case of all the ones that I'm aware of, they're critical to us getting our work done every day. And most of them have a fair amount of patient contact. And that's a real gift for a person to come into a clinic and have clinical experience when you're not, interning, as a counselor or something like that. So it works out. I think it's a great program.
Yeah. I think, Butch, I agree. I think that's a good thing to point out is the amount of patient experience or community experience and engagement that all the scholars get. It doesn't really matter in what position they are, even if it's internal and administrative. They're meeting a lot of different people for networking. They're probably working on research things directly with patients, and so there is a lot of patient engagement. So everybody kind of mentioned at some point just the level of interaction with people around you. So I was hoping that the scholars can especially go first on this, but who are some of the people that you interact with on a daily basis? And do you have any kind of favorite stories?
So yeah, I get to hang out with the nurse every day, Rose. We've become good buddies. And we do mostly telehealth and behavioral health. So I am always on Zoom calls with the psychiatrist and the patients, phone calls with patients. I talk to, a lot of the counselors are working from home right now also. So I will Zoom them as well if they need anything. Butch, obviously, there are health coaches here. There are behavioral health consultants here. We also all get to interact with each other. So I'll see Etta and Jaden all the time. And so we get to interact as scholars as well. So we get to learn about what I get to learn about what Etta does every day, and I get to see what the other scholars do every day too, which is really interesting.
Yeah, I think having that scholar community too, like every day, is great for me, or in my experience has been also really great. Yeah, because you do learn about other departments, and also like for me, Jaden is another scholar that works in physical rehab, and we're both doing our applications for school, or we have been in the past few months. So, just like checking in on each other, like, hey, like, did you write that essay? Or like, how's it going? Like, did you get someone to look it over for you? Like, do you want me to look it over for you? Just like having that like team mentality, I guess, has been really helpful. But yeah, I also interact with a lot of patients as well. I'd say my favorite patient interaction would be so I walk a lot of the patients back and forth, and one of our patients, she speaks Spanish, and so I speak Spanish, and we just like talk about our families like that are still in Mexico and stuff like that, and like just like joke around, and it was almost like a professional. And so one day, I think it was like towards the end of her coming to physical therapy, she brought these like caramel apples for me and another staff member who helps translate. And she was just saying that she felt like really taken care of, and like just felt like she was really at home. And for me, that was so cool I don't know, I just feel like that's the whole point of healthcare. So it was great to hear that from her, and like that she even brought a little gift. It was just so kind. So yeah.
That's amazing, and that's really cool. That kind of human connection. Yeah, I like what you said. Isn't that what healthcare is all about? Is making that human connection and helping somebody else, right? So I'd like to invite the supervisors to share on that same kind of theme. But do you guys have a favorite moment with the scholars? And I'll open that up to past scholars as well, because I know the interaction doesn't end with just a year. So.
I didn't get a caramel apple. I'm a little upset about that. But we usually share in PT with each other. But, there are a lot of good moments. I really do love to see the fact that it's fun to see our scholars interact with our patients and develop relationships. And the patient doesn't always separate who's the therapist and who's the scholar and who's working the front desk and that sort of thing. They just want to be cared for and loved on, so you see that on a daily basis. I think one of my favorite moments when I think about Etta's time here, honestly, was a challenging one. We had a patient who, when she was walking the patient back, she became dizzy and needed to sit down on the floor. And it was an opportunity. It was a chance there for Etta. She had to act, right. She was the one that was with this patient, and she used the training she got here and the skills she already had, and she took care of that situation and took care of that patient. The patient was fine. And it's nice to see when that stuff happens. We got a chance to talk afterwards and like kind of debrief. We always try to do that. I mean, I think there's intentional teaching that goes on formally and informally all throughout their experience here. And hopefully that gave her some confidence to act in situations like that in the future, as a clinician. So that was one of my favorite moments, was just seeing her do that. But you see that all the time, Anyway.
That's neat. Thank you for sharing. That's a cool story.
So I think the story that I want to share is, so a few weeks ago, we were in the midst of a staff meeting, and one of our coworkers was not able to be in the meeting, but she was on Teams. And so she kept seeing all of the chatter from staff meeting, and she was upset that she couldn't be a part of the meeting. And so she wrote to us and she goes, I got to hear what happened. I have a bad case of FOMO, or FOMO. And so I sheepishly go down the hallway and come up to Avani and say, what is FOMO? And she goes, oh, Butch, it's fear of missing out. And next thing I know, she brought down a list of 25 acronyms that every manager needs to know. We also have a lot of fun here at Church Health. And we have to, because some of the stuff that Avani hears is terrible, terrible stuff. You know, we hear stories of untold trauma in people's lives, and Avani, you know, has the privilege of getting to hear some of that, and to help. You know, some people watching and listening later may not realize that most of our therapy is offered by volunteers. And so we have a lot of therapists that, you know, got out of medicine because they didn't want to become proficient in electronic health records. And so this role of scribing or typing the notes out and getting the psychiatrist to approve the notes is a really important part of the work, and probably, I would guess, one of the more interesting parts of the job that Avani has with us.
Yeah, I think that's, I think you and Kevin both shared some interesting challenges that the scholars kind of go through, but also kind of the value, what the scholars are both learning and also what they're doing in the departments and working with professionals. But you guys both did raise up this kind of a good segue into another question that I had for you scholars is, what have been some of your challenging moments? What's been kind of difficult since you joined Church Health? It's been about 6 months, I think. So.
I'd say, like, at the beginning, it was kind of hard to get into the swing of things, just because there are a lot of different things from different, like I said, different parts of the department that I had to do. But once I kind of got in the swing of things, even now, just like Butch was saying, sitting in appointments with some of these patients, I mean, sometimes you can't do something right away to help them, and sometimes it's gonna, like, they know that it takes time. But there's also times where the patient can't afford a medication, or the patient doesn't have transportation to get to the pharmacy or to get to Church Health, or something like that. And, you know, we try to do our best to help them, and we try to find as many resources as possible to help them get to where they need to go, or pay for their medication, or whatever it is. So that's definitely a big challenge for me, is kind of just like wrapping my head around that, and being able to, I guess, you know, try my hardest to help with that. And I guess that's just that's what we do at Church Health. And that's something that I've learned. Another challenge would be, I mean, scribing has definitely got its perks, and I really enjoy it, especially with the psychiatrist. It can be hard sometimes, though, getting everything down, because a lot of our patients have a lot going on. So, but definitely a lot of learning going on there as well. So it's all good.
Yeah, Avani, what you said about, like, not being able to, like, immediately help someone, or I guess, like, more so in physical therapy, something I've noticed is, like, sometimes we see patients for, like, the whole time I've been there, like 6 months. And like, some of their conditions are, like, just so severe or so like chronic, I guess, that the improvement we see is like a lot. I guess the improvement I've seen seems not enough for the patient to be able to do the things that they want to do. And that can be, that can come from a lot of different issues. Like some patients, or a lot of patients, have like mental health issues that kind of prevent them from being able to engage with like their therapeutic exercise programs at home, or they just have like other stressors in their life, like finances, or taking care of like a generation of children, like many generations of children, or like domestic violence or something like that. So yeah, just it's been hard to see, like, you're not always in the most ideal situation when you're working with the patient. Like it's not always like a linear it's not always linear progress. And so even though that's been hard, I think it's made me realize that as a physical therapist, you have to be able to consider those like variables in your patient's life and try to come up with like a realistic goals and realistic like expectations for a certain amount of time. So.
I think that's really neat. Kind of, I like how you phrase that as not as linear progress, and I think that that's a real world lesson that at some point everybody needs to learn, is that progress isn't necessarily linear. But I think you all, the two of you, did a good job of kind of pointing out and kind of referring back to what you had talked about earlier, especially I think it was you, Etta, about just real world experience, and it maybe not what you expected or learned completely in school. And so I'm wondering, how do you feel that your school and your experiences, maybe during school, whether with clubs or sports, have prepared you for working at Church Health and moving into the real world, as it were?
So I was a neuroscience major at Rhodes, and so I got to take a lot of classes on brain disorders, drugs in the brain, things like that. And so I think it's interesting kind of putting all of that into my work here, sitting through these psychiatry appointments, and when the doctor prescribes like different medications for the patients, I get to kind of connect that back to my classes. Also, another learning experience that I've had here is that I get to connect back to my classes at Rhodes is the psychiatrist will always explain to me why he is prescribing the medication instead of another, like one antidepressant instead of another, or like, the medications like together, if they're put together, he's like, oh, I can't put this antidepressant with this anti-anxiety medication because they don't interact well, or this medication is you can't take that if you're easily addicted to drugs or something like that. So he really walks me through his thought process on why he's prescribing medicine, and I think that's really interesting, and I get to connect that back to school, and just kind of coming in with that knowledge really helped too.
Yeah, it sounds like kind of coming in with a foundation, but then being able to see how it actually applies kind of in a real world kind of clinical setting. Yeah, I could see how that could be a powerful tool for kind of learning and applying that knowledge, especially coming from a whole bunch of different psychological and backgrounds and models and things. So, okay. Etta, did you want to take a stab at that too?
Sure. So when I first started working at Church Health, I had to do a lot of just learning from scratch, a lot of things like computer programs, not a lot, but a few. And when I had a part-time job in college at the IT desk, not at Rhodes, but at a different school before I transferred to Rhodes. So I had to know how to use a really complex computer system. I'm not huge on computers, so just having that experience of oh my gosh, there's 11 tabs on 1 inch of screen was kind of helpful going into a real job where you have to navigate something like that. But also in college, I also had another job as a server. And this might be a stretch, but I feel like, like in a restaurant, you're working as a team to get like 11 things done in 1 minute. So also at the clinic, like there's a lot of that too. There's a lot of teamwork and like crazy amounts of communication to try to like see as many patients as possible and like have them see their therapist for like their full hour and, like get all their paperwork, get their vitals. And so just like practicing that, not just being a student at school, but also working, a lot of those practical skills have really saved me in this job. So.
Good. And I don't think that's a stretch at all. I think teamwork is teamwork, whether it's going to be in a restaurant and, trying to provide excellent customer service and quality food, or if it's in the clinic. And either way, it's still 11 people trying to do, or a team trying to do 11 things in 1 minute, right? As you put it. So no, I don't think that's a stretch at all. And I think that's a kind of a good way to put it, kind of using kind of the practical skills that you did use in school, as well as kind of the foundational knowledge. So with that, I'd like to open it up to the supervisors and ask you, what do you really see the scholars learning, and what is the value of kind of what you're teaching them as they move into their future?
I think that, there is a tedious administrative side of Avani's job. Setting up Zoom rooms with patients, setting up Zoom appointments with counselors is not it's not the most fun job here. But at some point, Avani's going to be a professional working in an office with an office staff, and she's going to remember what it was like when she was the front desk person. But at the same time, she has this other aspect of her job that's highly academic. Our volunteers, I think our volunteers continue to come here because we have the scholar program, and every week they get to be a mentor or a teacher. And so that's a really cool part of the job, and it's a really nice balance, I think, of administration and academic work here.
I think the thing that comes to mind for me is I hope that our scholars leave here as they start their careers as clinicians. I hope they leave here with a deep understanding of the mission that we have here at Church Health, that we try to encourage people to take care of their body and their spirit, and that those things are connected. And I think that, I'm a physical therapist, right? So yes, I am trying to help people with physical issues like pain, or they've had an injury, but those injuries or that pain may have, can be so closely linked to how they're doing spiritually, or how they're doing emotionally or psychologically. You just can't separate all of that, right? And I think this is a special place here that we actually put that stuff into those thoughts into practice. Our patients often get seen by behavioral health as well as physical therapy. That's something we try to do. We try to get people. Somebody might be coming for knee pain, but they need to eat more. They need to eat healthier, or maybe they want to lose some weight. That would help them with their pain. We sort of like we don't silo everything, right? Compartmentalize everything. We try to treat the whole person, and I think that's a special thing. And I hope that Etta and all the other scholars leave here, wherever they land in the world, that they try to replicate that in some way, whether it's in their own practice or in the hospital or clinic that they're working in. So.
Yes, and that's one of the things that I'll often say to all of our scholar cohorts and classes as they come in is oftentimes, for the program to be a success, all it really takes is for each of them to take one thing they've learned about compassionate, holistic whole person care, and apply it in their daily practice, apply it in their own lives, in their own professional worlds. And then our program is a success there because that's the point of the scholars. They're kind of the legacy. So after hearing that, Avani and Etta, do you guys have any insights or thoughts or things that you've learned based off what Butch and Kevin just shared? If not, we can go ahead and move on to another question as well. All right, so I would like to hear about some of the other things that you guys have done in the program. So the Church Health Scholars are full-time employees. They work about 35 to 40 hours a week. They get benefits. However, they are more than just employees. And so you guys have talked a lot about this learning aspect and how especially a lot of staff kind of work with scholars around that. So could you talk a little bit more about kind of what is the scholar role in relation to the general staff, and what are some of the things that you've done as part of the program with that?
So, I mean, I guess because of COVID, we haven't really been able to interact as much as we would want to with each other, the scholars and with the staff. I know sometimes when I get antsy, I go for a little walk around crosstown, and I oftentimes go say hey to Miss Cynthia at the Welcome Center. And when I'm down there with her, I get to meet a lot of the staff, and staff meeting, I'm introduced to them, but I only get to know who they are and they don't really get to know who I am. Yeah, I mean, I got to meet these scholars and I get to hear about other people in their departments whenever we hang out, whenever we talk. But I think that it's really interesting because here in behavioral health, I guess because of COVID, we're having all these people come work in the offices in behavioral health. And it's really interesting to hear like the health administrative side of things, because Jenna was down the hallway. Rose, the nurse, is really good friends with people here in Church Health, and they come say hey to her, so I get to interact with them then. But yeah.
Okay, cool. Etta, did you want to add anything to that?
Well, something that came to mind was the opportunity for service projects that the scholars are actually doing tomorrow. We're going to the Volunteer Evergreen path over next to Crosstown.
The green line, yeah.
Yeah, the green line. We're gonna go I think help with some of the flower beds or the vegetable garden or something. Just one of our scholars, Ben, organized it and invited the rest of the scholars to go do it. So that's been a great time to hang out with the scholars, be outside, and also give back to the community in a small way. So
yeah, so and I'll speak a little bit more about that. So throughout the program, scholars are encouraged to do service projects in the community and work with community partners, and so that's what Etta is referring to. And so one of our other scholars, Ben, has partnered with an organization, and yeah, we're going out tomorrow morning. I'll see you there to go do some volunteer work, and like you said, clean up some flower beds, and I think it's in their butterfly garden. But yeah, that's just one of the projects that we'll be doing this year. So yeah, awesome. Thank you for sharing that. So with that, I'm going to go ahead and jump. It's almost 2:45, so I'm going to jump over to talking about kind of inviting others to the program. So and I'd like to hear from everybody on this one, just who should look into joining the Scholars Program?
So I think that anybody who's interested in healthcare, we have a scholar position for almost every department in healthcare. Yeah, I mean, if you're interested, even if you're kind of just on the verge of maybe I should do something in healthcare, you get a good foot in the door, and you get really good connections, experience, patient interaction. Like Butch said, it is a gift, and it's all a huge learning experience too. So no matter what, if you're interested in healthcare, no matter what you're going to do, you're going to have a good experience that will help lead you in the right direction, at least.
Yeah, I would agree to all of that, and just also add that if you're someone who actually not all scholars just graduated, but if you're interested in taking a gap year or interested in taking an additional gap year before pursuing like some master's or doctorate program or something, this is a great opportunity to work during that time, but also like work in the profession that you are wanting to get into, make a bunch of connections, get a lot of mentorship and help with your application process. And yeah, just like have a community of people that are like rooting for you and wanting you to be successful in whatever you choose to do.
Yeah. Mm-hmm.
Yeah, I think there's going to be more of these with some of the other scholars, but we have scholar positions and even some of our administrations. I think there's a communication scholar. So there's any number of ways. I think that you certainly don't have to be Christian to be a scholar here. You can even be a person of doubt, but if you lead from this a social justice type ethic, this is a phenomenal experience, because every day you will work with people that our healthcare system has left behind. And our secret plan is that, whatever Etta does and whatever Avani does, they will always make room for those least among us.
I think that is very well put, Butch, but I don't know how much of a secret that secret plan is. I mean, we tell them on day one, hey, this is your purpose. This is really what we're hoping to get out of your investment in being at Church Health. So, but I appreciate that. That was well put. Kevin, I'll go ahead and hand it over to you.
I mean, I can't top that. That hits the nail on the head right there, right? I think anybody that's interested in exploring how healthcare could be and how integrated care makes a difference. I think people exploring if you want to explore how your faith lives out in action in what you do in providing healthcare. In our physical rehabilitation department, we're not just looking for people who want to be physical therapists. We want people who believe in this mission, are intrigued by it, and are excited about the idea of taking care of others and in maybe a creative way that you won't see. I don't think there's anywhere like Church Health in the country. There are things being done on a small scale, but I think this is a really special place. If you don't know exactly what you want to do, if you don't know if you want to do optometry, or if you want to be a counselor, this is a good place to sort of sort that through with people that are going through the same stage of life, likely that you are. And to have this, I think, I don't forget who said it, but somebody having a culture, having a group of people around you to provide encouragement and counsel, it's so key at that age of where you would be taking a gap year. So.
Yes, and again, I'd like to kind of highlight some of the words y'all use. So Kevin, you talked about if you're kind of if you're finding it intriguing, and but you're talking about even if you're in a place of doubt, I think that highlights what kind of both Avani and Etta, you were saying earlier about your experience, about how this really is a good chance to explore. It is a safe place that has support. We really talk about this concept of a church health family among our staff and as part of our culture. And so I think the scholars, coming from kind of the administrative perspective of kind of the program, the scholars really help foster that among the rest of our staff. And so through your learning, really help encourage learning amongst each other. And so I think that is something that by having such a breadth of scholar positions, is you guys kind of create this united whole, because y'all are constantly learning from each other, but then learning from and teaching other staff members at the same time. And so I kind of think it creates this cool kind of social interconnectedness with church health. So with that, just kind of some final words from our scholars and our supervisors. What advice would you give to any students who are interested in applying for the scholars program? And so I'd like to open this up to Avani and Etta first. And it's okay, go ahead and everybody take a minute to think about that. That can be a big question. It's all right.
So I'll jump in and say, well, I think it's important to know going into the position that you'll be working with a lot of patients who are underserved in a lot of different ways, not just healthcare in Memphis. So just kind of reflecting on like why you want to work with this population of people and what it is you want to like provide in that interaction and what it is that you can learn from that experience. I definitely encourage any applicants to check out the church health website, check out who's in whatever department they're wanting to look at, reach out, email, set up a Zoom call, reach out and talk to people. People are really excited to tell you more about what's going on here. So I would not be afraid of making that first connection yourself.
Yeah, I agree with what Etta said. I would also say that anyone who is applying should be prepared to take on a role where you're going to be working hard and you are going to be working with a population they need help, and like there's a lot that can be done and there's a lot that can't be done, but it can be emotionally taxing at times. And so I would encourage people to like realize that it is a hard job, but it is rewarding in its own way, and you do get a lot of experience, and you do get healthcare is different in every population and every community. So, this is just one way that we can get that experience, but it can be difficult too.
All right, with that, I'll open it up to Kevin and Butch. Do you guys have any advice to share for potential scholar candidates?
I feel like since my name begins with a B, I'm supposed to start these things all the time. But I do think that, we obviously have fun here, but we really do take these roles seriously. And I would encourage you to take the application process seriously. I know Alan's going to talk to you about those details, but we really are interested And particularly now, when the only way you're going to get to see us before you arrive on site, if you're hired, is in a Zoom call. We really need to know who you are as much as you can tell us in the personal statement, your essays, the things like that. We do read those things. Last year, Avani's predecessor was asked to find his replacement, and he did a really good job. And when these resumes start coming in, we'll have Avani review them first, because she knows what it takes to succeed in this job. And maybe she'll give you her email address so you can send her gift cards and things like that, so that she could be helped along that way.
I'm gonna go ahead and say no to that one, just because of that process. And Avani, is this the first time you're hearing about you're going to be reviewing applications?
I kind of had an idea, but
okay, no surprises.
Yeah, I would just say that I would encourage applicants to, when they're answering questions about why they want to come here, why they want to be a physical therapist, why they want to be a doctor, whatever, or why they want to be a scholar, to dig deeper than I want to help people. We all want to, right? That's great, but I would look at the reasons why. What is your drive? What are you trying to? I would just ask people to dig a little deeper than, I had an injury and I once had a physical therapist and it was great. It seemed like a cool job. I would just really I'm looking for somebody who is sort of excited by the whole mission that we have here, that is willing to receive from our patients, not just to give, to be able to to meet people where they are. It's really easier to get in that helper role where you have sort of a power over someone. And I don't want that. I want somebody who who wants to connect to people and to inspire people and to be inspired by our patients. So that's what I'm looking for from somebody who wants to be here. Is sort of that sort of humble servant leadership kind of place.
Amen, Kevin.
And then I hope our scholars on the call listen to that and kind of took something away about yourself through that kind of reflection, because that is very much what I hear from many of our supervisors is we look for people who are looking to be here with our mission and who are here to care for one another and kind of live into that. What I'm going to go into right now is I'm going to talk a little bit about the application shows and the program itself. So I'm going to share my screen. Can people see the screen? All right. So yeah, all of our program information can be found on our scholars website, which is churchhealth.org/scholars, and it will take you directly to our about the program page. I'll try not to go zooming through that, but you can find just basic program information on the first page. We'll have future webinars up here as well. You can meet the current cohort, or you can go to our FAQs page, and that'll answer some of the basic and general questions we get about the program a lot. You can meet the current cohort here and see everybody who's part of the current scholar class. You can go look at the program page, which as we have more webinars, we will be posting them up here as well for people to register. And so those will be here. This is today's. And then when you're ready to apply, you can look at the available positions where all the positions and their descriptions are located. And then there's the application page. And so the application page will contain all the requirements for the program. Pretty much our main requirements are we require all candidates to have a 4-year degree by the time the program starts. So if you're graduating in May 2021, program starts in June 2021, so that's perfectly fine. You can get applications in and still go through the interview process. And so like I said, the program will go from June to June. The application is here, and so you'll have 2 forms. The scholar application, you can open it here, and then we recommend really creating your application in a Word document and then uploading it afterwards, or kind of copy and pasting. There's a couple components to that.
So we will require an up-to-date resume, and we make those as professional as possible. We really recommend talking to career service offices on your campus and seeing if they can help. We do require a personal statement. This is about, I want to say our max is 800 words, but we really ask you about, why are you wanting to come to Church Health? What are you trying to learn about? And then we also have an essay that's included, and this is more of a critical thinking and ethics. And so we really try to make the application mirror either a medical school or kind of graduate school or going on to a professional school process. And so that way you get the interview, you're practicing creating a personal statement or working on your resume. And those are real things that you just need professionally, either as a student or a professional moving into a career. And so we'll also require 2 letters of recommendation. So there's a link in the Scholar application that you can send to either professors, people you've worked with in the past, or you can just click this link. It'll take you to the same place, and you can just send that link to whoever you would like to provide you with a letter of recommendation, and they can just upload it really quickly on their own, and we'll get those and match those to your, or put those with your applications. So under all that, we have our how to apply instructions. We also have our timeline. So the application is now open. The priority deadline, which will be February 15th. So you want to get your application in by February 15th, and then interviews will start being scheduled in early February based on the applications we have at that point. Between February and May, we'll review the applications and we'll be scheduling interviews with candidates, and then final decisions will be made in early May by May 7th. And so with that, the program will start in June. So as I was saying earlier, program requirements, you're required to have a 4-year degree by the time the program starts. You have to have earned that degree within the past 3 years. So you can be out of school for a couple of years and still apply to the Scholars Program. And of course, we recommend a GPA of 3.0 or higher.
So all that is on our website. And you can go there and see that. You can also learn more about the program by looking or watching the Day in the Life episodes that are on our Facebook and other social media sites like LinkedIn and Instagram. Each of those episodes is 2 or 3 posts throughout the day, featuring each of our scholars in different positions and just talking about what they're going through each day. So with that, I would just like to thank everybody for coming and joining us on this webinar today. It is now 3 o'clock. So we're going to go ahead and just say thanks and goodbye.